Good afternoon. Thank you all for joining us for today's webinar, Public Health and Bioethics, Bioethics for Every Generation. My name is Dawn Hagland. I'm the Senior Director of Professional Development at the Society for Public Health Education. On behalf of SOPHE, we are pleased with the interest in today's webinar and are thankful that you've taken time out of your day to participate. We're delighted to partner with the Presidential Commission for the Study of Bioethical Issues in a series of 3 webinars. Today is the final presentation in this series. Before we begin, I'd like to cover a few housekeeping items. I encourage you to take down the phone number on the slide. Hopefully with your webinar link today, you also have this information in case you're experiencing any technical difficulties. You can reach the support at this number, 866-229-3293, in case you have any difficulties during today's webinar. A few notes. All participants will be muted for the duration of today's webinar. After hearing from our presenter, we will have a question and answer time. You can submit questions anytime throughout the course of the webinar in the Q&A portion of the chat screen on the right-hand side of your screen. Feel free to submit questions anytime throughout the presentation, but we will collect them and go over them at the end of the webinar. We value your feedback and ask for you to complete a feedback form that will pop up in your internet browser immediately following today's webinar. Your evaluations of this program and all SOPHE programs will assist us in planning future webinars. We appreciate your taking a moment to complete that at the end. Just a note, today's webinar is being recorded and will be archived in SOPHE's online learning portal, the Center for Online Resources and Education, also called CORE. The recording will also be made available on the Bioethics Commission's website at www.bioethics.gov. For those who wish to receive continuing education hours, SOPHE has been approved to provide Category 1 continuing education contact hours. This program is designed for 1 hour of Certified Health Education Specialists and 1 hour of CPH renewal credits by the National Board of Public Health Examiners. Please visit SOPHE's CORE. The website is here on the page, sophe.org/education, and create a CORE account. You can log into the online account in the next few days, and you will be able to access your continuing education hours. For those of you who are not familiar with SOPHE, we're a nonprofit organization founded in 1950, dedicated to providing global leadership to the profession of health education and health promotion, and to promote the health of all people. Members include health education professionals and students throughout the United States and internationally. The organization promotes healthy behaviors, healthy communities, and healthy environments through its membership, its network of local chapters, and numerous partnerships with other organizations. SOPHE provides leadership to the profession of health education and health promotion through research, quality practice standards, face-to-face and distance education and advocacy. On to today's webinar. The presenter for today's webinar is Dr. Lisa Lee. For the last 4 years or so, Dr. Lee has served as the Executive Director of the Presidential Commission for the Study of Bioethical Issues. Dr. Lee came to the Bioethics Commission with an impressive work background, including her experience at the Center for Disease Control and Prevention, where she served in a variety of roles, from an epidemiologist to the acting chief of HIV incidence and case surveillance branch to serving as the chief science officer in the Office of Surveillance, Epidemiology, and Laboratory Services. Dr. Lee will be sharing her experience with us today, in addition to findings from the latest Bioethics Commission report titled Bioethics for Every Generation. We're delighted to have her join us today and share the recent results findings. Dr. Lee?
Thank you, Dawn, very much. It's quite a pleasure to be here. Just on a technical note, the slides on my screen are not advancing.
Oh, I apologize. Let me do this really quickly. Maybe
okay. Okay, let's see. All right, here I am now. Let's see if this works. Terrific. Thank you for that kind introduction. It's a delight to be here to talk with you and your members about the Bioethics Commission's most recent report that was released last week called Bioethics for Every Generation, Deliberation in Education in Health, Science, and Technology. I am, let's see if I can get the slide to move forward here. Well, okay, thanks. As you mentioned, I have a background in epidemiology, public health, and ethics, and have brought these three things together to do some really interesting work both at CDC as well as here at the Presidential Bioethics Commission. When I was in school, I saw this great cartoon from the New Yorker that says, and it was so typically brilliant of you to have invited an epidemiologist. And I thought to myself, wow, I'm going to get some pretty impressive gigs. I'm going to be able to put on a little black dress and some pearls and be invited to Park Avenue and talk with other really impressive people. And while I haven't gotten any invitations to cocktail parties on Park Avenue, I have gotten some really great opportunities to share the passion I have for both public health and ethics, and this, in fact, is one of those great opportunities. So thank you again for the invitation. So as you mentioned, Dawn, we have been collaborating on this SOPHE webinar series to look at three of the pieces of or projects that the Bioethics Commission has worked on over the last many years. And the first webinar you heard from Katja Chillag on our Ethics and Ebola report, which was, while it was around the topics of the the Ebola outbreak in 2014 and that through 2016, it really was more about, in general, what should we be doing in terms of the ethical perspective on public health preparedness and emergencies. So that webinar has been archived and is available. In addition, you've heard from Karen Maher on our ethics analysis on the STD studies that were done in Guatemala around the same time that, and including some of the same researchers in the Public Health Service around the same time as Tuskegee. So our connection as a commission to public health, in fact, is there and is actually, we've done several different topics related to public health, and I'll talk about some of those in a minute, but I know your audience has already heard about these two. Today, we're going to focus not so much on a particular topic area in terms of public health, but a couple of overarching themes in order that the Commission has addressed. That is skills in democratic deliberation and ethics literacy, and really looking at these two themes that the Commission has used to resolve some of the most pressing bioethical issues, whether they're in medicine, technology, or public health, and using these two methods and techniques to address some of these tough problems. So we'll talk a little bit about the Commission. I know most of you have heard a little bit about them from the last couple webinars. We'll talk about their public health topics. And then again, the idea here is the methods that they have used to address their particular assignments, and those include democratic deliberation, ethics education, and a mutual reinforcement of these two methods to ensure that we have both ethics literacy as well as decision-making capacity. So then we'll have time for questions. So let's start with the Bioethics Commission. We were authorized to exist by President Obama in 2009. We have members from a variety of disciplines, as the President requested. We are chaired by Dr. Amy Gutman, who is a political philosopher, and we are vice chaired by James Wagner, who is an engineer. And then we have as you can see from the folks listed there, we have influences from social sciences, from bench science, from medicine, from law, from philosophy, so bringing all different kinds of perspectives to bear on bioethical issues and questions. We this commission has addressed many public health topics in addition to the ones that you all have heard about. We've also addressed other topics that are squarely in the purview of public health. A couple of these, the first two there you see are the couple that we've talked about already. The purple one there is a report we did at the request of the Secretary for Health and Human Services on the ethical considerations around doing medical countermeasure research with children to be prepared for a potential bioterror attack with a variety of things, but in this particular instance, she was very interested in our taking a look at and thinking about the anthrax vaccine and whether we should, the question was really, should we put children at risk in research for an anthrax vaccine when we don't have any sense of how likely it is or whether it's likely that we'll have a bioterror attack with anthrax, and or that we would do the science here that we hope never to use in the future. I mean, most of the time we do science, we want to use the results. In this case, we would hope we would never have to. It was a very thorny issue, one that that created a great deal of angst among all of our participants in that deliberation, and we came out with, I think, some extremely solid moral and scientific justifications for an approach to doing medical counter research with children. So for any of you who do preparedness or that kind of public health work, that might be something you want to look at. The other couple of things we've done. One, we did another report that is about privacy and whole genome sequencing, which at first blush doesn't seem so much like a public health issue, but when we think about the move in many states to do whole genome sequencing or large-scale sequencing of newborn screening, this becomes an incredibly delicate issue, and so that whole report is around privacy and related topics. So really worth taking a look at. And then finally, we, in public health, do a lot of research. We do a great deal of public health research, and the Commission did a report on the current research ethics regulations and how well those actually protect subjects and participants, both in the U.S. and abroad. So all that to say that the Bioethics Commission has done a great deal of work in public health, and while we're not, again, going to focus today on particular public health topics, rather the methods and skills needed to resolve any number of public health issues. So we'll focus today more on the how, not so much on the what. So the what. Talked a little bit about that. Let's turn to the how. So democratic deliberation and ethics education. Why these topics? Why are these two things that help us think about the how? Well, firstly, we all will likely face bioethical issues in our own lives, whether it's making a decision for what kind of care for an elderly relative or an extremely premature newborn, or deciding whether we want to participate in a public health study or a clinical trial. We all will face some kind of bioethical issue in our lives. And we also know that, so just as regular citizens, but also in terms of public health policy decisions, these are often extremely complex, and they bring up deeply held values, and often these values are in opposition. So we really need to be thinking about how we can get past the very contentious approach to trying to resolve and move forward with public health policy, and deliberation is one of the ways that we can do that, and we'll talk some more about that. Democratic deliberation is a method that will help policymakers engage in a constructive public engagement with not only scientific experts, but also people with lived experience and members of the community, affected communities, et cetera. So we know that the method of democratic deliberation, the way we approach policymaking, can be extremely helpful. We also know that in order to prepare for people to engage in a democratic deliberation, they need to come to the table with some ethical literacy. That is, they have to be able to ground, we have to be able to ground the deliberation about bioethical topics with skills in reasoning, with understanding that we're not looking so much to be talking about what people should think, but actually how we should approach a problem. And those are the ethical reasoning skills we'll talk a little bit more about. So in developing this report, like all of our reports, we held 4 public meetings, and we had presentations from all kinds of experts in all different areas, as you see listed here: nursing, medicine, communication, public policy, and speakers and members then engaged in conversations about this. We also, as always, have put out a request for public comment in April of 2015, and we got many really detailed and interesting public responses from that. So that also helped shape the deliberations. So the Bioethics Commission has done a great deal of relevant work related to both deliberation as well as to bioethics education. It has modeled the use of democratic deliberation through all of the topics that it has approached, from synthetic biology through medical countermeasure research through research ethics. So it has approached its own work using this method. So it's modeled that successfully. In addition to that, the Bioethics Commission has been very committed to bioethics education for all of its reports. We've developed over 60 now materials that educators can use to help tease out some of the ethics education or the ethical issues associated with various topics. So, and we know that many of you have used these educational resources. We've heard from you, and we really encourage you to check back on our website because we continue to add new materials. In fact, we recently added 3 public health case studies that are specific to our work in ethics and Ebola that you know, really kind of present a case study and then allow for in-depth discussion of not just the scientific issues, which are clearly important, and the evidence issues, but also the moral issues. And we've also recently added, just last week actually, some deliberative scenarios to help people develop skills in deliberation, because deliberation, as we'll learn next, is not just another way to have a conversation. It is actually a decision-making process, and we'll talk specifically about that process. That was the first part of the report that was released last week is actually about democratic deliberation. And so, I mean, part of what the Commission found as they did their work over the year for this particular report is that, you know, we live in a place with many, many examples. We live in a country that's extremely polarized. We have a very polarized political climate, but social climate as well. And sometimes thinking about how to move forward on a challenging topic can be overwhelming, because it's just really hard to help people get out of kind of a name calling, or if you disagree with me, you're you know, not right, or you're stupid, or, you know, but really to help people think about engaging in a productive conversation and deliberation about moving forward, getting to a solution. And in public health, there are many, many examples that we have that are challenging in this way. One I thought of right away was just this idea of what conditions should be reportable. We have our reportable conditions, and deciding what should be added to that list. People have very strong feelings about what should or shouldn't be on that list. Some of those feelings come from scientific evidence and empirical evidence. Some of those strong feelings come from the moral bases on which people base their views. So that's one. Another is, which we've just recently experienced, is how best to manage quarantine in the face of either a new or a poorly understood infectious disease. To make decisions that people who are affected by them will participate in and find legitimate, deliberation is a way to make that more likely. As I mentioned, we modeled democratic deliberation as a commission, and it's really important to know that deliberation is not the same as a discussion or a debate. Deliberation is a particular method, and we'll talk about how to do it in a minute, but I do want to make clear that it is a method of decision-making that requires two important things. It requires mutual respect, and it requires reason-giving. So unlike a discussion, which is primarily to learn new information, to learn factual information, or to learn about a particular topic, or unlike a debate, which is to have a winner, to have two different sides and somebody wins the debate. Deliberation is really this approach where it offers an opportunity to address an open question with respectful and reason-giving, respectful discussion and reason-giving in order to find a solution that is mutually agreeable. Mutually acceptable policy solutions can be very hard to find in contentious topics, and this is one of the methods that can help us get there. So how do we do it? How do you do democratic deliberation? What does it look like? Well, here is a small screenshot. No, you can't read it. It'll get bigger in a second, but it's a screenshot of an appendix that is included in our report that actually outlines the 5 steps of democratic deliberation. Now, in addition to these basic steps, there are a number of other considerations that depend on the particulars of the decision that needs to be made, and that'll become clear as we go through each of these steps. So the first step of a deliberation is we have to begin with an open policy question. So deliberation is a method that is useful for some things and not useful for other things. And one of the things that's kind of a given in a situation where you want to use democratic deliberation is that there's actually a decision to be made, and there are distinct points of view that need to be considered in moving the decision forward. The question should have some kind of applied component. It should be to do something. So it answers the question, what do we do about this? Now, when we say what do we do about this, it involves several things. One is we need to think about what we're going to do about something with plenty of time to actually have a deliberation. Now, this is important because in a couple of the things that the Commission has done, in fact, the medical countermeasure research, the National Science Board did say, yes, it is important for us to have data on anthrax vaccine safety and efficacy in children. We don't have those data now, and if something happens, we'll want to know what to do and how much, for example, to, how to calibrate the vaccine for kids, et cetera. And that board also asked then for an ethical analysis in plenty of time before we have to actually implement a study like this. That contrasts with ethics in Ebola, where we were in the middle of a public health crisis, and there were lots and lots of tough ethical challenges that we were trying to deal with as the epidemic unfolded. So ideally, we have plenty of time to deliberate for maximum impact. That said, even if we find ourselves in a situation like we did with Ebola, where it sneaks up on us, or we're in the middle of it, conducting deliberation simultaneously is really, it can be done and can be done well. It was done well in many examples in the Ebola outbreak. So, but ideally, we would have plenty of time to deliberate. In addition, we ask ourselves this question of what should we do here? We need both scientific evidence as well as input from people who are affected by the decision we're going to make. Now, so it's less about the pure science, what can we do to make this better, than it is about both what can we do, of course we need to know that, what are we able to do, but also what should we do. And that's where having a mix of people to enter this conversation is really important. We want to ensure that we have sound, relevant evidence to inform the deliberation. We want to be able to use new information as it emerges and, in fact, ensure that using established facts that all parties agree on is part of the approach. Now, this resembles very, very closely what we do well in public health. We engage affected communities. There's the whole effort of community-based participatory research. This is a step for public health decision-making that I think is one we're very good at. The point here, though, is to ensure that just doing, as hard as it is, doing engagement of affected communities or community-based participatory work is really important in democratic deliberation, but it's just one step in the broader deliberative process. It's one, as I said, in public health we do well, so it shouldn't be a huge lift to make sure that that one is successful. The fourth step then in a deliberation is to foster open discussion and debate. This is where the divergent views come to the table, and using mutual respect and using reason giving, people come to the table and commit to working it out, to come to a policy decision, to come to a recommendation about what to do next. What should we do about this problem? Now, mutual respect is something we talk a lot about. Here we specifically mean active listening, understanding different perspectives, also correcting misinformation, acknowledging what we don't know. That's extremely important. The other piece of that matters a lot is understanding the value perspectives. And we'll talk some more about how that is important later on. But I think it's really important for us to specify what we mean by a mutually respectful conversation. And it is about listening and understanding, ensuring that people are open to new information that might change their perspective, et cetera. And then the reason-giving piece is also really important, and these are the two characteristics that underlie the whole idea of democratic deliberation. And reason-giving is about giving accessible reasons for one's beliefs. And we'll talk some more in a minute about what that means and why that's important. The fifth step then in deliberation is to develop a detailed actionable set of recommendations. It's really important that deliberation not be a feel-good exercise that, oh, look, we brought all these people to the table, everyone agrees, everyone's really glad with the decision, and leave it sit on a shelf in a report. Participants really must trust that their efforts will be fed back into policy decisions, that the question of what do we do about this or what do we do next is actually informed by this process of deliberation. And that's the key for setting the stage for legitimacy for policy. So given all this information that the Commission had about what deliberation is all about, they made several recommendations in the report, and the first was really to inform bioethics policy decisions by using this approach, just like they did and just like other bodies do, but that stakeholders in the democratic process at all levels, now that doesn't just mean federal, it means local levels, could be institutional levels, that this is an approach, a method that should inform policy decisions in health, science, and technology. It should be used for controversial issues to promote mutual understanding and respect, which we talked a little bit about, but really importantly is to promote greater legitimacy for the policy itself. Participants in deliberations do report that they feel much more positive and supportive for an outcome having been involved, even if that outcome isn't exactly what they would have done or what they wanted to have done. So it's that kind of creation of a sense of being heard and being able to participate in the decision-making process through this deliberation, through using both scientific evidence as well, or empirical evidence, as well as understanding the moral bases for these tough decisions. The second recommendation they made was to conduct these activities in a way that, as they stated earlier, where mutual respect and reason-giving is important. Organizers of deliberative activities should make sure that activities are based on empirical evidence of best practices, but also participants should be required to give accessible reasons for their arguments while they show respect for fellow participants. So think of it in a way of respectful interaction. You know, we no name calling or dismissive comments or these ground rules. All participants must be in it to find a solution. We know in debates, for example, there's often, you know, I'm going to try to convince you of my way, and you're going to try to convince me of your way, and whoever does that wins. That's not what deliberation is all about. The respectful interaction really is about understanding where that person is coming from, what they're basing their views on. And how we understand what people are basing their views on is through reason-giving. One of the requirements of a deliberation is that people must explain why in an accessible way so other participants understand why they're coming from that perspective. So we have to justify our moral views in a way that others can understand it. So if I believe something, I must state why I believe that. So a very simplified example is, should we quarantine people who come back from doing global health emergency work on Ebola? Okay, so we have factual information that gets fed into that. We know that I would be able, if I said to someone, yes, I think we should quarantine people, and I would have to say why. I would say, well, in fact, it's highly contagious. And I would also have a moral justification for that and say perhaps public health's obligation is to keep the community safe from infectious diseases. Fine, great factual and moral justifications, both of which are then open to challenge. Someone could say to me, well, factually, indeed, it is highly contagious, but only if symptoms are present. So if we take the moral justification that public health has the obligation to keep the community safe, we could do that without quarantining people who are not symptomatic. So the process is that kind of give and take, clarifying the factual information, allowing for clear and accessible justifications for the moral bases of people's sense of how things are. So that's one of the most important pieces of engaging in a deliberation. The third recommendation that the Commission made then was to engage in these kinds of deliberative methods to make these kinds of decisions and to develop some some measures and some ways to evaluate what are best practices for a deliberation. Because aside from the two kind of important things that undergird the deliberation, that is mutual respect and reason-giving, there's a lot of flexibility in how to approach a deliberation. You could vary the number of participants. There have been deliberations with 12 or 15 people. There have been other kinds of deliberations with hundreds of people. You can also, depending on the topic, the length of the deliberation might be an hour, it might be days, weeks, might be long time, much longer than that. It really depends on the issue to be resolved. And the recommendation here is for people who conduct these kinds of deliberations to actually think about ways to evaluate both the process and the outcomes so we can establish some best practices as we move forward. So those were their fundamental recommendations around the use of deliberation. The other really important theme in their work has been bioethics education. So I want to talk just a little bit about what they recommended there. We know that ethics education can prepare people to deal with bioethical issues that arise both in our own personal lives as well as in our professional roles. And so it's clear that if we are going to implement ethics education, it should start in the early school years and continue through postgraduate and professional training. Not all students will go to college, so we have to prepare people to make these kinds of decisions early in their education. The Bioethics Commission acknowledged, however, that there are some challenges in terms of implementing this kind of bioethics education. In large part, teachers face some challenges. It might be the lack of training. They just don't know how to do it, and they're not sure how to handle a situation. They might be afraid that their administration or their parents of their students would be upset. Often parents might feel like they are against having a teacher indoctrinate, quote unquote, their students with a particular approach to something or view on something. And so the Commission wanted to be extremely clear that what we're talking about in ethics education is helping students think about how to think about something, not what to think about it. And so we really, the Commission felt strongly that we had to help teachers understand that what we're trying to do is teach a process. We're trying to teach skills in how to deal with difficult ethical questions. So they're looking really to improve 4 basic skills when we approach an ethical challenge. One is to identify what the moral or the ethical issues are. Some questions we can answer with empirical evidence. Those are the what can we do questions. But others we have to answer with moral justifications, and those are the questions about what should we do. So we have to be able to identify which kind of question it is, and if it is actually a moral or an ethical question, then we need to teach people the vocabulary to how to articulate that that's what it is that's snagging or that's creating some kind of dilemma. We need to help people understand how to deliberate a path forward, which we just spent many minutes talking about, and then help people understand how to implement and evaluate their decisions. So ethics education is not a list of things to necessarily do or believe. It is a list of, if it must be a list, it's a list of a set of skills to help people identify moral questions, articulate their concerns, deliberate about how to move forward, and implement and evaluate those questions. So given that their findings, they made several recommendations, the Commission made several recommendations about bioethics education. And the first was to implement foundational, broad-based ethics education at all levels, starting in pre-K all the way through professional school. And it should be integrated into whatever curriculum kids, professionals are learning. Starting early is key. I mean, we can't teach engineering students calculus if we fail to teach them foundational arithmetic, and the same kind of thing goes for ethics decision making. If we want to help people make clear and thorough ethics decisions, we have to teach them how to do that. And there are lots of different schools of thought about ethics and what makes someone ethical, et cetera. And then the Commission said, yes, yes, and yes. We should be developing character and virtue. We should be helping students learn how to reason ethically, and we should promote decision-making skills. So all of those things really play a role in this foundational skills. And then using the best methods available, and I think that goes without saying. The second recommendation they made around the bioethics education was that not just is it really important in primary school and secondary school, but at the graduate level and the professional level, there should be very specific ways to develop, implement, and emphasize bioethics that are specific issues related to a particular field, whether that's medicine, engineering, public health, et cetera. In public health, we know that only about half of the schools of public health require any ethics education, and most of that is only for some students. And I think one of the things that we are concerned about is that we want all students to get this, not just some students. And so there has been some progress in the field of public health with ASPPH, looking at outlining competencies that are related to ethics that they expect people to, at least people who go through SOPHE accredited programs, should come out of school having learned. The Public Health Accreditation Board that does accreditation for public health departments at the state and local level has also been really clear that there must be an approach to resolving challenging ethical questions in a health department. So each of these public health organizations have ethics competency requirements, but our training programs might not be adequately preparing graduates to engage in this kind of decision-making, and that's something we should be thinking about as a field. The third recommendation they made in terms of education was to really help support educators. There are, as we talked about earlier, there is a lot of hesitation around teaching ethics, in large part because of external pressures, but in some cases for teachers themselves not feeling prepared to do so. And there are several really great resources for teacher training. NIH has some, the Northwest Association for Biomedical Research has some, Georgetown has some resources for educators. So there are some out there, and we really encourage people who will be teaching this to explore those. We also hope that teacher training programs will provide teachers and students with equitable access to ethics education. This was something that was really important to the Commission and obviously resonates with us in public health, which is the justice piece of it. I mean, we will all face bioethical decisions in our personal lives, whether we go to college or not, and we have to ensure that everyone has access to this kind of decision-making skill development so we can make good decisions related to our personal and community lives. We know that in many places these kinds of topics, ethical decision-making topics, are only offered in advanced classes by highly motivated teachers who are instructing the highest achieving students, but that's not enough because it's not just physicians and engineers and public health professionals who will deal with the inevitable bioethical issues we're all going to face. It's also food service workers and tradespeople and anyone who engages in and lives in a community, which is all of us. Finally, the Commission really thought that, I mean, some of you have likely already put this together, that in order to do effective deliberation, we really have to ensure that we have ethical literacy of the participants. And when we put those two things together, there is a synergy that happens. So they're mutually reinforcing. We know that ethics education can prepare people to articulate and identify and articulate their values and participate in such a deliberation. And we know that deliberation can enhance education and develop more informed students, more informed professionals, and importantly, more informed citizens. And one of the favorite quotes from this report is that deliberation and education are joined in a virtuous circle, reinforcing one another to create a more democratic and just society. Sounds a little bit like motherhood and apple pie, but I think it's really something to keep our eye on in terms of what it is we want from this teaching people these skills. So they made two recommendations regarding this mutual reinforcement or this virtuous circle. One is that we should indeed foster this kind of mutual reinforcement. We should help educators and organizers of deliberative activities use these tools to facilitate civic engagement. And we should use these activities, deliberative activities, to address pressing bioethical issues, whether they're developments in health or public health, in science or society, technology, et cetera. And then as the Commission is entering its last few months of service to the President, they were also very clear about the fact that they hope that other future bioethics commissions continue to further the deliberative and educational roles that this commission has taken. We really feel strongly that bioethics, because it affects everyone, can help encourage the discourse and civic involvement to develop legitimate policies, or policies that are viewed as legitimate by the people that they affect. And we hope that future commissions will continue this kind of work. So I want to end there and just give us a few minutes for questions, and I know that Dawn will take this back and she'll moderate the questions. And I thank you very much for listening and encourage you to reach out and connect with us at the various addresses here, our website, which is bioethics.gov, and our other Twitter handle, etc. Thanks, Dawn.
Thank you, Dr. Lee. As a reminder, if you have any questions from Dr. Lee's presentation to us today, I encourage you to type them into the Q&A portion of your of the webinar here, or the chat function if that's the one that you see most readily. And I have a few questions waiting, but please feel free to type in questions and we can continue asking Dr. Lee. So I'm going to start with one question. It seems obvious that people who choose public health as a career are ethical. They care about people. They want to make things better. Is it really worthwhile to require a course in ethics in an already jammed NPH curriculum?
Boy, that's a great question, and I've heard that question before from other audiences, and I think it's really worth reflecting on. I agree that in all my years of working in public health, we are really lucky to have colleagues who believe in the mission, who come to public health and give up lots of other things to really work for social justice and health equity and all of these things. And that's really one of the most rewarding things, I think, for many of us in this field. That said, I also think it's really important that we think about that being our own confidence with our own moral compass, for example. Like, of course I'm going to do the right thing. I believe in social justice. That seems like such an obvious thing. Why do I need to be trained to do that? To recognize that deliberation and learning about making, engaging in moral justifications for decisions is not about necessarily what I think is right for me or what I think is right for other people. It's really about ensuring that the pluralistic kind of nature of our communities is respected, and that it's everybody has an opportunity to come to the table with their own moral compass pointing to their own true north, and be able to talk about that in order to deliberate what solution should be implemented in a policy that's going to affect all members of the community. So yes, it does matter that most public health professionals are oriented toward justice and toward ethical approaches to things. What we have to keep in mind, though, is it's not just decisions we're making for ourselves, it's decisions we're making for our entire community, and they, in fact, should be involved as well.
Thank you. As a follow-up to that, you'd mentioned in your presentation that only half or a portion of MPHs are offering ethics classes. So what would you recommend to either college graduates or MPHs even that have not undergone any extensive ethical training in their public health programs? What do you recommend to them?
That is also a really good question. Usually, public health schools and programs of public health have some kind of offering of an ethics course. So it's not that only half offer it, it's only that only half require the course to be taken. And most of the courses that we've looked at are around research ethics, which is a really important piece, especially for people, obviously, who are going to be doing public health research. But there are all these other ethical questions about that we do in public health, that we approach in public health. How do we keep separate, for example, the very real legislative influence in public health, in local public health, and how do we ensure that we make the right decision about what activities and programs to prioritize. There are lots of different questions that aren't related to research ethics that public health professionals face. And how we deal with that differs by our training and by support around our health departments, whether there's experience in a previous experience with a similar question. And I think the important thing is for public health professionals to recognize, firstly, that they are dealing with some ethical problems and ethical dilemmas. Most of them we probably do just fine deciding about, but those that are really sticky or difficult or for which there isn't one single answer, we might need additional help. We might need to have a deliberation. We might need to think about the other moral perspectives that need to come to the table. How do we get that? How do we get training in how to do that? Well, there are a couple of options. There's a lot of information, really good information about ethics training and ethics decision-making out there, and I've listed a few for folks, especially for teachers. But CDC also has some really useful, practical, applicable training around public health ethics. Their public health ethics website, and also they've been partnering with NACCHO and others to do trainings around the country to help local, state and local public health departments, tribal and territorial as well, to actually do some of this training. So there are resources available. Ethics is something that's, especially decision-making skills, is something that tends to be learned best when learned together, that is, with others. So even setting up something like an ethics journal club at a local health department, using some of the activities and educational materials that the Bioethics Commission has created for a professional training might be an idea. So, and I do encourage, if anyone does have specific questions or is looking for a particular kind of material, to either drop us a question at info@bioethics.gov or to inquire with the CDC Public Health Ethics Group, because they're very active in this as well.
Great, thank you. You touched on democratic deliberation. We have a question about, you used Ebola as an example of how that's been used. Could you speak a little bit to the how that could be used in reference to Zika?
Sure, good question. So if you think about what we talked about in terms of what is democratic deliberation, well, we start with an open question about what should we do. So one of the, there are many different questions about what should we do in response to the Zika outbreak. One of the key questions I was just reading about the other day was, should we introduce genetically modified mosquito that will reduce the mosquito population that carries the Zika virus? Now, people would say, well, is that really a public health issue? Yes, it's a public health issue. It's a public health intervention to reduce disease, to reduce morbidity and mortality. But it's also an environmental ethics issue. We talk about the ecosystem and whether reducing mosquito population will have other effects that we need to know about that could potentially be bad, or other consequences that we need to be aware of, good or bad. So it's exactly these kind of complex ethical questions like Zika provides and other public health interventions and problems provide us, where we really need to get around the table. We need two things. We need to say, we need information about what the science tells us, and we need information about how we feel about doing that, what we value about that. So for Zika, the science tells us that if we do release certain mosquitoes, we could basically rid the mosquito population in a place of, we could take it out of existence and then reduce the harm that might come from Zika, as well as other mosquito-borne illnesses. So the science says this is possible. Then the question is, well, from an environmental perspective, what might happen? We could spin out some examples of what might happen. There might be people who feel very strongly that based on the environmental justice and naturalism and other things that we should not alter a mosquito population. There might be other people who think, yeah, absolutely, like we live on a planet and the planet is here to serve us, and here's how one way we could do that. So there are all these different perspectives, and they have to come around the table in order for the decision to be made and for it to be, its ramifications to be accepted by the population. So the idea is that open question, differing views, trying to answer the question of what we should do based on what we can do, and ensuring that all of those voices get around the table, can be understood, and are motivated to come up with a solution.
Great, thank you. I have one last question, unless someone has another question they want to type in here in the next moment or two. So in public health, we do a lot of community engagement, community assessment, community needs assessment. Could you speak to how deliberation is different than asking, affected communities what they value?
That's also a really great question. I mean, and as I mentioned, I do think we do a really good job in public health, better than many other fields, of engaging the people we serve, and I think that's something that again is critical, also really important. It's one step in the deliberation, so it reflects more of what I called earlier a discussion. In fact, if we ask people, affected communities, what they value or what they think, we're learning what affected communities value and what's important to them, and that is a start. The question really for a deliberation is, what should we do about something? So certainly it's really an important thing to answer. What are the interests of affected communities? What do they prefer? What would be helpful and why? But other important inputs need to be included as well, including accurate empirical and factual evidence. Beliefs and desires, often are rooted in inaccurate factual information. So we need to be thinking carefully about how to engage in this kind of deliberation so we can help address whether some of these factual inaccuracies are occurring. So there is a lot to do in terms of a deliberation, and engaging the community is one of those steps. But again, it's part of a bigger process.
Great, thank you. I don't have any other questions. Is there any last words you'd like to add before we close up for today?
Well, firstly, thank you. I appreciate the opportunity to talk with my public health colleagues about these important issues. I encourage people to peruse the website at bioethics.gov, both for the public health topics I talked about that the Commission has worked on, but also for the report on how to do deliberation and why education matters, and it's all the accompanying educational material. So I hope people will look, and if you do, please give us a shout if you have questions or comments. We'd love to hear from you, and you can reach us at info@bioethics.gov.
Thank you, Dr. Lee. On behalf of SOPHE, thanks to all of you who participated in today's webinar. Special thanks to Dr. Lee and her team at the Presidential Commission for the Study of Bioethical Issues for this outstanding webinars and the two previous in our series. If you have missed either of the two previous webinars, please go to SOPHE's core. The website is on your screen to access our recordings and continuing education. Thank you again for attending today, and this ends our webinar for today. Thank you.